The topic of my talk, dying, there is still no place like home. I have a paradox and a tip for you. The paradox is, I'm a physician, my team and I treat about 3,000 patients a year. We have a 100% death rate amongst our patients and almost 100% satisfaction rate from them and their families. And no, we're not in the euthanasia business. And here's a little tip for you. One day, all of you will die. It's the only single certainty there is. Since the majority of you are inhabitants of what is referred to as the developed world, most chances that you will be aware that the end of your life is near. Because you will die from cancer or end-stage heart, lung, kidney or liver disease, or one of the neurodegenerative illnesses. That's actually a good thing, knowing when you're going to die. It's good because knowing the end of life is near, and trust me, even 2-year-old children who are terminally ill know when they're dying. Knowing that allows us the huge privilege of saying goodbyes, closing loose ends, telling your loved ones what you meant for them and what they meant for you, allowing yourself the gift of dying healed, if not cured. In short, allowing a good death. It wasn't long ago that dying was known to be a natural thing. People died, and they usually died where they lived most of their lives, in their own home. Only in the last 100 years or so, dying became unnatural, and legitimate place of death of those escaping immortality became the hospital. I'm here to reclaim home as the best place to die. Thanks to giants like Cicely Saunders, Dame Cicely Saunders, the whole concept of palliative medicine was evolved. And thanks to another giant, Elizabeth Kubler-Ross, death and dying are not only legitimate topics to discuss with our patients, it is our obligation to do so. Physicians who talk to their dying patients only about treatments, tests, surgery, chemotherapy, radiotherapy are actually possibly robbing their patients of their right to die well. For some physicians and for some nurses, this is actually a paradigm shift and a huge change from the world they were used to. We should change our whole conversation, our whole language that we speak. Changing words that we're using today like losing the fight, like quitting, like surrendering, should be changed with words like choosing, assuming responsibility, respecting life choices. Again, this is a huge paradigm shift for some of the caregivers. We should talk about advanced directives, meaning how patients want their end of life to look like. Palliative end-of-life care is a rare example in medicine where the best medicine is also actually the cheapest one. There's a real win-win-win situation here. The patient wins, so does his family, his professional caregivers, and society as a whole wins. The huge difference between today and 100 years ago is that today we have the medical tools to assure that people can die with essentially no physical suffering. Combining these two basic truths, 1, the need for palliative approach to the end of life, and 2, the medical ability to prevent suffering, is why my team and I strongly believe that people should be allowed to die at home, where they were dying since the beginning of humankind. In the last 4 years, we have managed to set up a nationwide home hospice in Israel, allowing any patient that chooses to do so to die within the comfort of his own home, his own bed, surrounded by the people he loves the most. In the longer talk, I'll tell you how we did it.